Okay, everybody, we are going to continue on with our next body system, the cardiovascular system. So we're going to talk about the heart, and then we are also going to talk about the circulatory system, which is kind of the other half of our cardiovascular system in our next lecture. So a couple of things we're going to talk about today are our major structures, the membranes, some of the valves, the direction or pathway of blood flow through the heart and lungs, and the overall cardiac cycle. So this is kind of just a full overview. So this is our thoracic cavity. You see your trachea, your thymus gland. A lot of these other structures we'll talk about today, but you'll see we have our two lungs. The heart is in the middle of the lungs, and there's a kind of a cutout in this left lung to make space for the heart since it's oriented towards the left. Then we have our diaphragm that is inferior to all of our heart and lungs, and that is our cutoff before we get to the abdominal cavity. Okay, so the membranes of the heart, or our heart wall, so going from in to out. So this is the deepest structure here is our endocardium. So the endocardium is the lining of the heart on the interior. So the atria and the ventricles, our major chambers, they're going to be lined with this endocardium. Going farther out, we have our thickest layer, which is the myocardium. So that should tell you that's the muscle layer, since we have that root of myo, so the myocardium. And then the actual membrane, remember with our serous membranes, we have a parietal and a visceral layer. So the parietal pericardium is going to be the outermost layer. We're going to have the pericardial space in between our parietal and visceral layer. So that's just going to have fluid, try to prevent friction. And then directly against the heart, we have our visceral pericardium, which is also known as the epicardium. So the parietal pericardium is our outermost layer. We have the pericardial cavity, which has fluid to prevent friction while our heart is beating. And then we have our visceral pericardium or epicardium that's on the heart's surface. So this is an echocardiogram of the heart. And this is just going to kind of highlight our biggest structures here. So we have our left ventricle, our left atrium, our right atrium, and our right ventricle. So this is a little hard to see orientation-wise. So let's look at this picture here. So we have our right atrium, our right ventricle, our left atrium, and our left ventricle. So you'll see our ventricles have much thicker walls here because they're in charge of pumping blood a lot farther, like especially our left ventricle. It's going to be the last pump before it goes all the way out to the body, which we'll talk about a little later on. But the more muscle is needed to actually make that happen. So separating a few of the areas, we have valves within our heart. So separating the right atrium and right ventricle, we have the tricuspid valve. From our right ventricle, we have the pulmonary valve that is going to regulate our flow from the right ventricle into our pulmonary arteries. So that's going to take blood to the lungs. We have the bicuspid valve that is going to separate our left atrium and left ventricle. So this is called the mitral valve or the bicuspid valve. Both are the same thing. And then to get from our left ventricle to the body, we have to pass through our aortic valve prior to going to the aorta, which is going to be the main branch off the heart that begins carrying blood to the whole body. So those are our primary valves. Okay, our arteries and veins. So you should always think arteries away. Arteries are going to carry blood away from the heart. veins are going to carry blood back to the heart. So you'll see we put our valve labels back down here. So the pulmonary artery and pulmonary veins. Sorry, actually, let's start with the vena cava. So our inferior vena cava and our superior vena cava are going to be our two veins that are bringing blood back from the body. So all the veins in our body from our upper half and our lower half are going to drain and eventually go to the inferior or superior vena cava, and that is going to return the blood to the right atrium. So our right atrium is the first stop from our body. So to get from our right ventricle to our lungs, we said we had to pass through the pulmonary valve, and then we're going away from the heart, so we're going to go through the pulmonary arteries. So typically when we think arteries, we think oxygenated blood, but because we haven't hit the lungs yet, our pulmonary arteries are going to be our only arteries that carry deoxygenated blood. The deoxygenated blood is going from the right pulmonary and left pulmonary arteries to the lungs. To get back to the heart, we need to carry the blood through the pulmonary veins. So we have a right and a left pulmonary vein for each lung. Those are going to empty into the left atrium. And now we have oxygenated blood because we just got the blood back from the lungs where our gas exchange occurs. So the pulmonary veins are going to deposit it in that left atrium. It's going to go through the mitral or bicuspid valve into the left ventricle. The left ventricle is going to pump it through the aortic valve, and our aorta is going to carry it to the body. As I said, typically arteries are going to, or really always arteries are going to carry blood away from the heart. Veins are going to carry blood back to the heart. We typically associate arteries with oxygenated blood and veins with deoxygenated blood, but our pulmonary artery and veins are the exception to the rule. So our pulmonary arteries are the only ones that have deoxygenated. Our pulmonary veins are the only veins that have oxygenated. Okay, this is an actual cadaver heart or a human heart. So not quite as clear cut as it is in our blue and red picture, but this is what it looks like in real life. And so you can see the pins show you the different structures there. Okay, so let's walk through that pathway again here. There's a YouTube link down at the bottom that goes through this pathway as well. This is definitely something that you'll want to go through a couple times to get down pat. So the main things that I want you to think of is obviously the actual direction of the blood flow in terms of where it's flowing. So think of what chamber it's passing through, what valve it has to pass through to get to the next chamber. Make sure you know kind of how it goes to and from the lungs, and of course how it gets all the way out to the body, and then from the body back to the heart. So you should also pay attention to where our blue and red arrows are, because blue is going to represent deoxygenated blood, whereas red will represent our oxygenated blood. So you should know your pathway and your actual kind of heart components, but you should also know where we're having deoxygenated blood and where there's oxygenated blood. So let's walk through this together. So we'll start with number one. It's our superior and inferior vena cava. So these are our two really large veins that are going to bring blood back to the heart from the upper body and from the lower body. So both of these are going to empty with deoxygenated blood into the right atrium. So now we have deoxygenated blood and we're in the right atrium. So to get from the right atrium to the right ventricle, we're going to pass through our tricuspid valve or our right AV valve, the atrioventricular valve. So that's the tricuspid valve. And so now our deoxygenated blood is located in our right ventricle. Our right ventricle's job is to pump that deoxygenated blood into our lungs. So it's going to go through the pulmonary valve and then travel through the pulmonary arteries, because we're going away from the heart, through the pulmonary arteries to the lungs. So that'll go through the right and the left pulmonary arteries. Now our deoxygenated blood is located within our lungs where gas exchange can occur. So the lungs are going to add oxygen and they're going to send it back to the heart through the left pulmonary veins and right pulmonary veins. So those veins are going to carry our now oxygenated blood and deposit that in the left atrium. So now we're back in the atrium. We're back in the upper chamber, but we're on the left side. We're going to go through the left AV valve, which is our mitral or bicuspid valve. So that's going to connect our left atrium to the left ventricle. So now our left ventricle, our strongest ventricle, has all of the oxygenated blood. And so it's going to pump that oxygenated blood through the aortic valve up into the aorta, and that will carry the blood all throughout the body. So that's our pathway. So as I said, you may want to rewind this and listen to that again, look at the YouTube video, start practicing kind of putting these steps in order. Okay, one other thing we're going to talk about is the cardiac conduction or our electrophysiology. So our heart beats with input from our nervous system. This is going to be our autonomic nervous system. This is an involuntary system. So remember, we can't tell our heart muscle to pump. So our pacemaker in the body is the SA node, the sinoatrial node. So it's our primary pacemaker. It's the one that is supposed to be setting the pace, and it's supposed to beat at about 60 to 100 beats per minute. So it has its own kind of metronome that tells it to beat every so often. So usually 60 to 100 beats per minute. So from the SA node, that signal is then going to pass to the AV node. Our AV node is going to send the signal down through the bundle of His. So there's right and left bundle branches, and then right and left Purkinje fibers. So save, SAAV, save his perk, save his perk. That's the way it travels. So SA node's primary, AV node is where it reaches next, then it goes to the bundle of His, and then it goes down to our Purkinje fibers. So we said that the SA node is our primary pacemaker, but you'll see next to the AV node and Purkinje fibers, I also put parentheses with beats per minute. That's what BPM means, is beats per minute. So if for whatever reason our SA node is not functioning properly or it's not working anymore, our AV node will take over and it beats a little bit slower. And then same thing, if our AV node and SA node are having a problem, then our Purkinje fibers also have their own set rhythm to them, but this is much slower, 20 to 40 beats per minute. So that's really not enough to sustain good cardiac function. So an EKG or an ECG, an electrocardiogram, is how we measure the electrical activity of the heart. If you ever see kind of like that classic beeping monitor that shows the spikes going across the screen, that's going to be your electrocardiogram. And those different spikes and waves correlate to the electrical activity passing through the heart. Okay, I put a couple of YouTube videos on the next couple slides, so go ahead and take a look at those. That just helps kind of reinforce the blood flow and especially the cardiac conduction. And this one shows you a little bit about that electrocardiogram and what the pieces mean. I won't make you guys label an EKG or anything like that, but it just gives you a good insight to the clinical side of things. Okay, let's go through some vocab here. So you'll notice on your week 5 list, you see some of the same prefixes, suffixes, and roots. You'll have some new ones, of course. And then there's a good sized list of our abbreviations and our additional terms. So make sure you take a look at those as well. As we keep going through the systems, we will keep trying to introduce those additional terms that you'll hear relatively frequently if you're in any type of healthcare field. So go ahead and pause it for now. See if you can identify what some of these defects are or what these words mean here, and then we will go over it together. So go ahead and pause your lecture. When you are ready, go ahead and come back and restart. Okay, our first one is an aneurysm. And so an aneurysm, you can think right down here, you can think of it as a bubble. So aneurysms can often be almost like a ticking time bomb in terms of it's only a matter of time until that arterial wall gets too weak and actually explodes. So what causes an aneurysm is we have blood flowing relatively quickly through our arteries. If the pressure from our blood weakens our arterial wall, or for whatever reason we have a weakening of the arterial wall or our blood vessel wall, it kind of opens up a pocket and the blood will flow into that pocket and create this aneurysm or bubble. So it's when a piece of the arterial wall weakens enough that it kind of splits off. So the patent ductus arteriosus, so our ductus arteriosus is what separates our aortic and pulmonary trunks. So in an infant, there's an opening there, and it's supposed to be like that because as infants in the womb, they're unable to really create our separation of oxygenated and deoxygenated blood. So initially, having that window between the aorta and the pulmonary artery was a good thing. And now, if we grow up and still have that, it's a patent ductus arteriosus. And that means that that hole didn't close up. And now we have a mixing of deoxygenated and oxygenated blood, which causes a problem. A patent foramen ovale is also a similar disorder, but our foramen ovale is the opening between our right and left atria. And so that also is supposed to close up when we mature. So if this foramen ovale doesn't close up, again, we get a mixing of deoxygenated and oxygenated blood, which is a problem because we end up pumping deoxygenated blood into the systemic circulation, which does not have the nutrients and oxygen needed. Okay, interventriculostomy. So that used at least one new root. So remember, we start with our suffix when we're defining a word. So stomy is going to be an opening. Inter is going to be between, and ventriculostomy, or sorry, ventriculo is our combining form for ventricle. So surgical opening between the ventricles is an interventriculostomy. Cyanosis, you should remember that from our integumentary system chapter. That was when we had not enough oxygen in the bloodstream, which gives our skin that bluish appearance. Arrhythmia, so IA can be condition. A is without, and rhythm is going to be our heart rhythm. So arrhythmia is the absence of a heart rhythm. Auscultation, I think that's on your additional terms list, and that is to listen with a stethoscope to the heartbeat, or could be lung sounds as well. So auscultation is going to be to listen in with the stethoscope. A sphygmomanometer, so meter is our suffix for measurement. Sphygmo is our word for pressure. So a sphygmomanometer is how we take blood pressure, or is the term for blood pressure cuff, sphygmomanometer. Okay, systole, that is our pressure when our ventricles are contracting. So that's going to be the higher number, the top number of our blood pressure. And then diastole is when the ventricles are relaxing and our atrial pressure is being measured. That's our bottom number of blood pressure. It's going to be the lower number typically. So that's diastole. So when you write blood pressure, you see it as your systolic blood pressure over your diastolic blood pressure. So they used to say 120/80 was normal. Now they say you should shoot for 110/70. So 110 systolic, 70 diastolic. So those are your two numbers there when you see a blood pressure. Okay, last couple slides, we just have some more practice. So again, go ahead and pause your lecture for now. And when you get your words down, go ahead and restart and see how you did. Okay, disease of the atrium is going to be an atriopathy. Disease of heart muscle is going to be a cardiomyopathy. So a myopathy is just general muscle disease. You have to add that cardi root onto it. So cardiomyopathy is disease of the heart muscle. For 3 and 4, these are easy to get confused because their abbreviations are very similar. So 3, recording of the heart using electrodes is going to be an electrocardiogram. You'll often see that abbreviated as EKG instead of ECG. And then you have recording of the heart using sound is going to be an echocardiogram. So electro for electricity or echo for sound. Condition of having a blockage, we're often going to call that ischemia as it relates to the heart and our circulatory system. So emia is specific to a blood condition. So ischemia. Fear of your pulse. So our suffix for fear is phobia. And you could use that rhythm root for pulse. So you could say you have rhythmophobia. And I think you may have one other on your list for pulse. Let's just double check. I don't want to tell you the wrong thing. I believe we might have one other root for pulse that you can use besides rhythm. Oh, of course, sphygmo. So same thing. Sphygmo is your root for pulse or pressure. So your fear of pulse could be either rhythmophobia or sphygmophobia, fear of a pulse. And then pertaining to without symptoms, this is probably a word that you have heard many times, but pertaining to, we use IC most of the time. Without is going to be a or an. In this case, it's an A, and then our root for symptom is pretty much symptom, so asymptomatic. All right, one more practice. This time, instead of the word, we're going to go with the definition. So pause, take your time, use your new word list, and then restart the lecture when you're ready. Okay, intravenous. So inter is between, but intra is within. So intravenous, that's going to be within the veins, within the veins. Atrioventricular is going to be pertaining to or relating to the atrium and ventricles. And usually this is going to be almost the in between those. So like our AV valves, our tricuspid and our mitral valve are our atrioventricular valves. So relating to the atrium and ventricles. Hypersiderosis. So this is a new root for you. Remember, osis is our abnormal condition. Hyper is excessive. And then that SIBER root is for iron. So excessive amounts of iron is hypersiderosis. A stethostomy. So we said earlier that a stomy is a surgical opening. And then steth is actually another name for chest. So stethostomy. Ventriculopathy or ventriculorrhaphy is going to be a surgical repair or suture of a ventricle, ventriculorrhaphy. So aortotomy is going to be a incision into the aorta. So tomy is our suffix for incision. Aorto is our combining form for aorta. And then our last one is ischiopoiesis. Ischiopoiesis, so that SCH kind of makes a sk sound. Ischiopoiesis, just like ischemia. Ischiopoiesis. So poiesis is our suffix for formation. And then our ISCHO, isco, is our combining form for blockage. So this is going to be a formation of a new blockage. So that is the last thing I have for you on the heart. Like I said, we will also do the circulatory system this week as part of week 5. And so some of those terms are on your list as well. And keep an eye out for that recorded lecture coming up soon.